everyone, welcome back. It's me again. My day ones, thank you for always watching my videos, liking and leaving a comment and sharing. And if this is your first time coming across my channel, welcome on board. Please consider subscribing. My name is Lillian and I work as a registered nurse here in the UK. I am originally from Kenya in Africa, and I did my nursing training here in the UK. So today I really want to discuss about UTIs. UTIs stands for Urinary Tract Infections. And the reason I really want to talk about this topic is because UTIs are often misunderstood and may be associated with stigma or embarrassment. I have a lot of friends from Africa, in Kenya and Tanzania, and several of them have been sending me messages being scared, being worried that they've got UTIs and they are embarrassed. And then a few of them asked me if a UTI is a sexual transmitted disease. And some of them said, I'm really shocked because I haven't been sexually active, so where did I get the UTI? So please, I want to tell you that UTIs are not typically considered sexually transmitted disease. UTIs are generally caused by a bacteria entering the urinary tract. However, some sexual activity can sometimes contribute to the development of UTIs in some individuals. For example, having unprotected sex with multiple partners can introduce a bacteria into the urinary tract. Additionally, improper hygiene practices or irritation from certain sexual activities may also increase the risk of UTIs. UTIs are very common and can affect people from all ages, from different ethnicities and genders. UTIs can affect both men and women. However, they are very common in women, and the reason is because of us women, because of our anatomy. So women, we have a shorter urethra compared to men, which makes it easier for the bacteria to reach the bladder and cause an infection. So I want to give you the symptoms of UTIs. What are the symptoms? So the first one is increased frequency of urination. So you may feel the need to urinate more frequently than usual, even if you don't necessarily pass much urine every time you go, but you just feel like, I want to go, I want to wee, I want to pass urine, but it's so frequent and there's not much coming out. Another symptom is burning sensation. A feeling of burning pain when passing urine, mostly described as a stinging feeling in the urethra. For example, if you have a wound, an open wound, and maybe you put saline or salt, it stings. So that pain, when you're passing urine, you feel that burning sensation. That's a very clear symptom that you've got UTI. Another symptom or sign of UTI is urgency. You just feel a strong urge to urinate. Sometimes even the bladder is empty, it's not full. Maybe you've just been and then you just feel a strong urge that I want to pass urine and there's nothing in the bladder. That's another sign of UTI. Another very, very common sign or symptom that you definitely have UTI is if your urine is cloudy, dark or it's got blood in it, that means you may have a UTI. So this means like your urine may appear cloudy or very dark, or have a reddish tint due to the presence of blood. And when I say cloudy color, is like, you know, the urine hasn't got its normal color. It's cloudy, like whitish, you know, something like that. I don't know how to describe how cloudy looks, but it's like it's not clear. And also if your urine is very dark and if there's like presence of blood, definitely that's a UTI and you need to speak to your doctor, or you can mention to the nurse and they will get you help. Another very common symptom and sign that you've got UTI is if your urine has a strong odor or smell. You know, you go to the toilet and you pass urine and you realize it's got this very unpleasant, unusual smell. It's more likely you've got UTI, especially if you're not drinking enough water. It's good idea to discuss it with your doctor and have it tested, your urine to be tested for UTI. Another symptom is pelvic pain, or you know, just discomfort or pressure in the lower abdomen or pelvic area. Sometimes some people also experience lower back pain. This can also be a sign of a UTI. The last symptom or sign of UTI that I'm going to mention is very common as well. You know, just feeling fatigue, lethargic, feeling generally unwell, tired. So some individuals may experience fatigue, generally discomfort or feeling of being unwell. It may be because you have a UTI and you need to speak to the doctor. I hope this video has reassured you and given you a little bit of knowledge about UTIs. Just know that UTIs are not sexually transmitted diseases. There are people that are not sexually active and they still get UTIs. There are elderly people that get UTIs. So I need to do a video about the causes of UTIs, especially if you're not drinking enough water, you know, you don't keep up with your hygiene, especially women. You know, with our anatomy, when you clean yourself, you need to be careful. When you, like for example, if you open your bowels, you need to know how to clean yourself because of our anatomy. You don't go from the back coming forward. No, you clean from the front going backwards. I know you know that, all women know that. And please remember, not everyone with a UTI will experience all of these symptoms, and the severity of these symptoms vary from person to person. So if you suspect you have a UTI, it's essential to consult your doctor or your healthcare provider for proper diagnosis and treatment. Because if you leave it, untreated UTIs can lead to more complications and more severe infections, like even, you know, affecting your kidneys. In my next video, I will be discussing about the causes. So there are people with urinary catheters. They do get UTIs very often. So these are the many more reasons of getting UTIs. So please just go out there and research. There's so much information that you can find on internet, on websites, articles, books. Please just, you know, research and find out more. Don't be scared or worried for nothing. That's it for today. I hope to see you on my next video. Bye for now. Thank you for watching. Don't forget to subscribe, like, share, and leave a comment. Bye for now. Bye bye.